Descriptive non-experimental design. This design observes and describes phenomena as they naturally occur, without any manipulation of variables by the researcher. Key characteristics. No intervention or treatment is applied. No random assignment to groups. Simply observes, measures, and describes what exists. Often used when experimentation would be unethical or impractical. Common types. Survey research, collecting data through questionnaires. Correlational studies, examining relationships between variables. Cross-sectional studies, data collected at one point in time. Longitudinal studies, same subjects studied over time. Example, a nurse researcher surveys 500 patients to describe their experiences with pain management after surgery, without implementing any new intervention. Strength, excellent for generating hypotheses and describing real-world situations. Weakness, cannot establish cause and effect relationships. Experimental design is the gold standard of research design, featuring both manipulation and random assignment. Key characteristics. Researcher manipulates the independent variable, intervention. Random assignment of participants to groups. Includes at least one control/comparison group. Strict control over extraneous variables. Common types. Pre-test post-test control group design, both groups measured before and after, only experimental group gets treatment. Post-test only control group design, only measured after intervention. Solomon 4 group design, combines both approaches for maximum rigor. Example, patients are randomly assigned to either receive a new wound care protocol, experimental group, or standard wound care, control group. Researchers measure healing rates in both groups. Strength, can establish cause and effect relationships with confidence. Weakness, often expensive, time-consuming, and may have ethical limitations. When to use each design. Choose descriptive non-experimental when you're exploring a new area, describing a phenomenon, or when experiments aren't ethical or possible. Choose experimental when you need definitive evidence about cause and effect, and you have the resources and ethical approval for random assignment. To make this practical, let's use a common nursing concern, managing post-operative pain. We'll see how a nurse researcher might approach this topic using each of the three designs. Descriptive non-experimental design in nursing. Scenario, a nurse researcher wants to understand the current state of post-operative pain management on a surgical unit. How it works. The researcher does not introduce any new pain treatment or change any practices. They simply observe and measure what is already happening. Methods, they might survey 100 patients 24 hours after surgery, asking them to rate their pain on a scale of 0 to 10 and describe their experience. They might also review charts to see how often pain medication was actually given compared to how often it was ordered. Nursing example in detail. A clinical nurse notices that patients seem to be in significant pain after knee surgery, but she's not sure if her observation is accurate for all patients. She decides to conduct a descriptive study. Over 3 months, she collects data from the electronic health records of all patients who had knee surgery, recording their self-reported pain scores at 6, 12, and 24 hours post-op. She finds that the average pain score at 12 hours is 7/10, which is higher than the unit's target of 4/10. This descriptive data provides the evidence that a problem exists, justifying the need for a change in practice. Why choose this? It's the essential first step to describe a problem, establish baseline data, or explore a topic where little is known. It's also very ethical and non-disruptive to patient care. Experimental design in nursing. Scenario, the researcher wants to get definitive proof that the bundle itself is what's causing the improvement, to justify implementing it hospital-wide. How it works. The researcher will use the gold standard, a randomized controlled trial, RCT. This involves randomly assigning individual patients to either the new treatment group or the control group. Nursing example in detail. The researcher designs a study where all eligible patients scheduled for knee surgery are invited to participate. Randomization. A computer program randomly assigns each patient to either the experimental group, receives the new pain management bundle, or the control group, receives standard care. Neither the patient nor the researcher can choose the group. Intervention. The experimental group gets the new bundle. The control group gets the hospital's standard pain management. Blinding. Ideally, this would be a double-blind study. The patient doesn't know which group they are in, though this is hard with a behavioral intervention like guided imagery. The person collecting the pain scores doesn't know which group the patient was in. Analysis. The researcher compares the pain scores between the two randomly assigned groups. Because randomization should have balanced out all other factors, age, gender, pain tolerance, etc., any significant difference in pain scores can be confidently attributed to the new pain bundle. Why choose this? It provides the strongest level of evidence. If an RCT shows an intervention is effective, healthcare systems and policymakers can be very confident in adopting it. This is the type of research that changes clinical practice guidelines nationwide. A simple guide to choosing a design. When a nurse researcher has a question, here's a simplified way they might think about which design to use. Start with description. I don't know what's happening here. I need to observe and describe the current situation. Use descriptive non-experimental. Prove causality with the highest rigor. I need undeniable proof that this new treatment works so we can change practice everywhere. I have the resources and setting to randomly assign participants. Use experimental RCT. Test a change in the real world. I have an idea for an improvement, but I can't randomly assign patients on my unit. I'll try it with one group and compare them to another similar group or to past data. Use quasi-experimental.